If these are not evaluated and treated in time, it can lead to permanent loss of hair in the affected areas. Today I wanted to discuss a common condition that we see in the dermatology clinic called Discoid Lupus erythematosus. This is an autoimmune condition that's often triggered by sunlight exposure. With this condition, small red patches may form in sun-exposed areas on the face, ears, or scalp. These round patches may develop alopecia or hair loss within them. It can present abruptly after sun exposure or more gradually after weeks of sun exposure, but that's often the inciting trigger for this condition to occur. These red round patches may become very inflamed and tender, or they may present more with the hair loss component. If these are not evaluated and treated in time, it can lead to permanent loss of hair in the affected areas. Because the scalp is commonly affected, it can become very distressing to patients who experience this condition. One of the most important things is if you notice patches of hair loss, it should be evaluated by a board-certified dermatologist so that you have the right diagnosis in place. There are many treatment options for this condition, including topical anti-inflammatory medicines, injected anti-inflammatory medicines that are placed locally into the affected skin, and also systemic medicines, medicines that we take by mouth or that are injected to help improve the inflammation in the body and lower the autoimmune condition. This combined with sun avoidance often can resolve early cases. However, if the case has progressed for a while and it's led to scarring in these patches, certainly we will still want to stabilize the patient and control their disease. But when it's controlled and they want to get improvement, once the scar has formed in those round patches, it's going to be permanent. So if it wasn't treated early medically, we may have to then entertain the option of hair transplantation in those patches if the patient wants to restore hair in those scarred areas. We at DSI offer ARTAS robotic hair transplantation or other forms of manual follicular transplant. And this could be an option for you if it's an end-stage condition. But my recommendation to you is get it evaluated early. Let's try to treat the disease process before it leads to the scarring. And if somehow that is not effective, or that the disease has presented at a time where it's too advanced, we would recommend hair transplantation in that case. If you like this video, please like, subscribe, and follow us for more hair-related content.